Hello friends, our today's topic is reimplantation. This is the very important topic in pediatric dentistry and endodontics. So reimplantation is nothing but the placement of tooth inside the alveolar socket again. The two important things to consider before reimplantation. First is the condition of the alveolar socket, whether the socket is intact or fractured, and second is extra-alveolar period. Extra-alveolar period is the time in which the tooth remains outside the oral cavity. So it can be less than 20 minutes and between 20 to 60 minutes and more than 60 minutes. Extra-alveolar time is short if it is less than 20 minutes, and then we will see the root condition, whether the root is having open apex or closed apex. In case of open apex, we will first soak the tooth in solution containing doxycycline for 5 minutes, and then we will rinse it after 5 minutes with saline, and then we'll reimplant the tooth. But in case of closed apex, we will rinse it with the saline and reimplant the tooth if the extraoral time is less than 20 minutes. Now if the extraalveolar time is more than 60 minutes, so first we will see whether the root is having open apex or closed apex. In case of open apex, we will dip the root in citric acid for 5 minutes, and then we will dip the tooth in 2% of stannous fluoride for 5 minutes, and after that doxycycline for 5 minutes, and then we will do the extraoral endo treatment and then reimplant the tooth and recall the patient after every 6 months. Follow-up of the tooth is very important to check the success of reimplantation. But if the tooth is having closed apex, we will first dip the tooth in 2.4% of sodium fluoride for 20 minutes. We will then clean the tooth, remove the necrotic pulp, and then we will start the endo procedure, extirpate pulp, and then we will bevel the apical end of the tooth, and then we will restore the tooth, and then we will check the socket and remove the clot from the socket, and then we will reimplant the tooth, followed by splinting of the tooth for 2 weeks. Removal of the clot from the socket is very important because clot may interfere with the healing of the periodontal tissue. The general treatment of avulsed tooth is, we will first rinse it with the saline, we will clean the root surface, remove the necrotic PDL from the root surface, we will examine the socket, whether the socket is intact or fractured, and then if there is any kind of gingival laceration, we will suture the gingiva, and then we'll reimplant the tooth and check the occlusion by taking the radiograph, and then the tetanus prophylaxis should be done. Antibiotic should also be given, and before removal of the splint, we will do the RCT in case of closed apex, and then follow-up should be done. Now coming to the various storage media used. Various storage media used for reimplantation is saline, and then tap water which should not be used because of its isotonicity. Then the saliva, but it has bacteria, so bacterial contamination of the tooth is very common. Then milk is the best medium because it contains amino acid, carbohydrate and vitamins. Low fat cold milk is used to store the avulsed tooth. Then HBSS, hang balance salt solution with having pH 7.2, and then Viaspan, and then Gatorade sport drink can be used, but it has acidic pH. Then propolis can also be used, contact lens, Amdogain, egg white, and the best medium is recently used is coconut water. Sometimes the patient store the tooth in the oral cavity or near the vestibule, but the salivary contamination can occur. Coming to the outcomes, the reimplanted teeth can have 3 outcomes, like normal, in which there is surface resorption and tooth will survive. Then ankylosis or replacement resorption, which is the most common. And then the third is inflammatory resorption, which leads to the resorption of the entire tooth. Replacement resorption of the tooth can be confirmed by percussing the tooth, and it will have the metallic sound during percussion.